Good afternoon, everyone. So, we are Group 1 and we are presenting on the food and beverage industry, the impact of fast food consumption on the rise of obesity and non communicable diseases. Our project description is the Industry Policy Decision Project. And our group today, Ms. Elizabeth Richards, who is our group leader, Ms. Lisa Pollinaire, Ms. Rochelle James, and myself, Sean Boudin. So in our first slide, you will see a gentleman who's a bit on the overweight side, consuming a lot of fast food. Too long after, a few moments later, we see him in the hospital being attended to by a doctor. And while the layout of the slide may seem a little bit comical, it speaks to the greater problem which we are addressing in our presentation about the consumption of fast food and how it can lead to obesity and other diseases in Trinidad and Tobago. And some of the factors which would have identified in terms of key factors and uncertainties are socio-economic, which speaks about fast food is considered to be a cheaper and more accessible product, especially for middle and lower income families. And this, because of the price, can lead to higher consumption. We also look at cultural factors. In many urban areas, fast food is seen as a symbol of modernity and convenience, or is associated with social status, enjoyment, and ease in many communities. Targeted marketing. Fast food companies often market aggressively, especially to children and adolescents, influencing their consumption patterns. Public health awareness. Fast food advertisements dominate media spaces, while public health campaigns are less visible or engaging. Lifestyles. Fast food consumption is often coupled with less physical activity, exacerbating health issues. And finally, government policy. Policy interventions such as taxes on unhealthy foods, subsidies for healthier foods, and stricter regulation on food industry can influence both supply and demand for unhealthy foods. We also looked at some uncertainties. Among these are changing consumer preferences. A shift towards health consciousness could reduce fast food consumption or encourage fast food companies to offer healthier options, which could alter the health impact on the consumer. Regulatory environment. New or changing regulations on food labeling, advertising, especially to children, or taxes on unhealthy ingredients could influence fast food consumption. Public health campaigns. The effectiveness of public health initiatives aimed at reducing fast food intake through education or community programs is uncertain. Technological advances, innovation in food delivery. Increased availability of fast food through delivery apps might increase consumption, or conversely, technology could make healthier eating more convenient. And lastly, economic conditions. Economic downturns may increase fast food consumption due to costs, or conversely could lead to a demand for more affordable home-cooked meals. I will now at this point hand you over to Ms. Elizabeth Richards.
Now we're looking at definition of scenario logics and the creation of scenarios. So we're using a one by one matrix. On your y-axis, you have predictability, and on your x-axis, you have impact. So on your x-axis, impact moves from your left to your right, low to high, and on your y-axis, predictability moves from south to north, which is low, and north is high. We chose 6 key factors. These were changing customer preferences, robust regulatory environment, changes in the economic conditions, effectiveness of public health campaigns, changes in technological advances or innovation in food delivery, chemicals in processed foods. When we plotted those factors on the XY axis, this is what we got. We saw for A had a low predictability and it had a high impact. B had midway predictability and we also had midway impact. C, those are changes in economic conditions. We had low predictability and it had have a high impact. E would have a high predictability and somewhat midway impact or almost low impact. F would have a high predictability and also a high impact. So the two factors we got that were low predictability and high impact was C and A, which was changes in economic conditions, and A, changing customer preferences. So now I'll turn you over to Lisa, who will now take you through the scenario construction.
Thank you, Elizabeth. So emergent from the factor clustering exercise were two variables. And these variables were changing customer preferences and changing economic conditions. As such, a high-level matrix was developed using these two nested factors. And you would have seen in this diagram, which give a representation of the variables, the potential, the variables, the variables that we use as well as the potential scenarios that we came up with. You would see from the x-axis, north to south, we have high changes in economic condition, low changes in economic conditions, as well as on the y-axis, we would have plotted low change in customer preference, as well as high change in customer preference. As I said, we would have created some potential scenarios, and emerging from these scenarios will be greedy, health conscious eater, poker pork no beef, and just plain miserable. So scenario one. When we look at the matrix, we determine that if there's low change in customer preference, however, there are high changes in the economic environment, the customer remains unaffected and continue with their regular eating habits. So we greedy. Scenario two, poker pork no beef. If there are low changes in both economic conditions and customer preferences, the situation remains the same. So the status quo remains. Scenario three, health conscious eater. This can emerge when there are drastic changes in customers' eating habits and when they gravitate towards healthier eating options. This is also influenced by the high changes in the economic conditions. And the final scenario was just plain miserable. This is the preferences of the eater could change if there are high changes in the customer's preferences and low changes in the economic conditions. As a result, customer may seek healthier options or combinations or even healthier choices within their food purchases. For example, they may decide on having a Diet Coke instead of regular Coke, have salads or low calorie dressing. I'll now hand you over to Elizabeth, who will take us through the
In the causal loop diagram, we use variables. And these variables, I'll take you through the diagram. So the first loop we have, which is R1, we're looking at fast food preference. The high fast food preference will cause the establishment of the high number of outlets, and of course, both moving in the same direction, it will be a positive polarity. So a high number of outlets, of course, will cause an increase in the accessibility of fast food. Both of them are moving in the same direction. That is also a positive polarity. An increase in accessibility will also increase the fast food consumption. That is also moving in a positive same direction, and that will also be a positive polarity. Of course, high fast food consumption would also go back into fast food preference. So that will also be and moving in the same direction. So that's also a positive polarity. That particular loop is a reinforcing loop, and that loop is anti-clockwise. So the second loop we're looking at is a balancing loop. That's B1. And you see here where high fast food consumption leads to high obesity and NCDs in the population. So both are moving in the same direction. So that is a positive polarity. High obesity and NCDs will lead to government healthcare expenses increasing. So they're both moving in the same direction. So that's a positive polarity. The government high healthcare expenses will also increase public health campaigns. Seeing that they're both moving in the same direction, that will also be a positive polarity. So we are seeing an increase in healthcare campaigns will also increase public awareness. That too is also moving in the same direction and it's a positive polarity. However, a high public awareness, we are seeing the dietary preference for fast food will decrease. So we're moving in opposite directions, and that would be a negative polarity. Dietary preference for fast food decreases. We are seeing fast food consumption will also decrease. So they're both moving in the same direction, and that would be a positive polarity. And fast food consumption decreases, then obesity NCDs in the population will decrease. Then they're both moving in the same direction. That would be a positive polarity. And the loop for that is a balancing loop, and it is clockwise. So the last loop we are looking at, which is B2, obesity and NDCs in the population, as that increase, then that will trigger regulatory regulatory environment. That will increase, and the polarity will also be positive. A robust regulatory environment that will encourage, we are saying that will encourage healthier options being provided by the fast food restaurants. So that, they're moving in the same direction, that will also be a positive polarity. However, healthier options provided means that persons will buy those options and obesity NCDs in the population will decrease. So we are saying that is a negative polarity. So for that particular loop, it is clockwise. I will now turn you over to Rochelle, who will take you through the recommendation.
Thank you. From the scenario analysis and causal diagram, the following recommendations are advanced. One, enforce government regulations. Introducing taxes on unhealthy foods, enforcing labeling regulations, and incentivizing healthier food choices are essential steps to reduce fast food consumption. Two, promote public health campaigns. Engaging in frequent public health campaigns which emphasize the health risks of fast food consumption and its direct link to obesity and NCDs may help to shift public behavior. Foster cultural shift towards healthy eating. Communities and schools should be engaged to advocate for local food traditions and healthier eating habits. And our final recommendation, improve access to affordable healthy food. Subsidizing healthy food options and making them more accessible and affordable for the general population can decrease reliance on fast food. And in conclusion, the rise in obesity and NCDs in Trinidad and Tobago is a complex issue that involves multiple driving factors, with fast food consumption being a significant contributor. Through the application of the Royal Dutch Shell scenario analysis approach, we have identified critical uncertainties and drivers that shape this issue and issued a causal loop diagram to understand the variables that influence fast food consumption and its impact. solutions are grounded in the scenario analysis. This provides an avenue for policymakers to address this growing public health crisis.
Thank you, Rochelle. So that is our presentation from Group 1, and we hope you enjoyed our presentation. So goodbye from all of us. Myself, Sean.
Lisa Polliner.
Rochelle James.
Bye.